Welcome. This is Dr. Emilio Justo, Medical Director of the Arizona Eye Institute and Cosmetic Laser Center. Today we're going to talk about eyelid muscle tightening. This is a type of procedure that is not well known because it's completely different from a blepharoplasty. Many individuals use the term eyelid lift, and usually when they're using that term, they're actually referring to blepharoplasty, which is simply removing redundancy of excess skin and fatty tissue coming down over the eyes. However, in eyelid muscle tightening, this is truly an eyelid lift because doing a muscle tightening procedure elevates the whole eyelid, the lid margin, so that it is separated away from the pupil. Now, eyelid muscle tightening is typically considered a medical procedure because individuals who have true what is known as blepharoptosis, which is a fancy word for saying eyelid drooping, where the upper eyelid margin actually comes down close to or even covering the pupil, this type of procedure is always medical. Now, what benefits are there in general to eyelid muscle tightening? Well, by elevating the eyelid margin and creating more distance away from the pupil, the patient will experience a much more increased peripheral vision, that is side vision. Additionally, these patients will experience far less visual fatigue and brow strain. So let's get into it. What are the two main techniques for eyelid muscle tightening? The one that I use 9 out of 10 times is what's called a conjunctival Muellerectomy. We just refer to it as a Muellerectomy in brief. Now, the big advantage of a Muellerectomy procedure is that typically it's done either under local anesthesia or maybe with a little mild IV sedation just to relax the patient. However, it does not require any type of general anesthesia. The procedure is relatively quick, approximately 15 minutes per upper eyelid, and the procedure involves everting the upper eyelid and then using a dissolvable suture on the underside of the lid. Now, once the procedure has been completed, I typically place an extended wear soft contact lens in the eye. Why, you may ask? Well, it's simply for comfort. It has no medical purpose, but this way, while the dissolvable suture is dissolving, the contact lens acts as a barrier so that when the patient blinks, they don't feel that suture dissolving. The patient will use artificial tears several times a day during this initial period of time and then return to the office within about 10 days, at which time we will remove the contact lens since typically the suture has dissolved at this point. Now, Muellerectomy procedures, generally speaking, do not create as much bruising and swelling as the alternative procedure, which we'll discuss in a moment. The Muellerectomy procedure is particularly useful for those individuals with small amounts of drooping or ptosis of the upper eyelid. In contrast, 1 out of 10 of our muscle tightening procedures, I use what is called a external levator repair. The levator is the main muscle which elevates the eyelid. Using an external levator repair technique, there is an incision made on the outside of the eyelid in the eyelid crease. Once that incision is made, the skin is dissected, and then that levator muscle is found by gentle dissection. Once the levator muscle has been isolated, the muscle is then advanced forward, sutured in place, and then shortened. By doing this levator procedure, one can create a significant amount of upper eyelid lift, thereby increasing peripheral vision significantly. Now, with the longer procedure does come more bruising and swelling with a levator procedure than a Muellerectomy, simply because there's a lot more dissection involved. But for those individuals who need significant tightening of the muscle, this would be the recommended procedure. The levator procedure, just like the Muellerectomy, is also done under local anesthesia with perhaps just a little mild twilight to relax the patient, especially since the levator procedure is going to take approximately 30 minutes per eyelid, so about twice as long as the Muellerectomy procedure. Thank you once again for taking the time to listen to this video. I hope I've been able to answer some of your questions. I greatly look forward to seeing you personally for a consultation.